You know, Parkinson's disease is a neurodegenerative disorder that predominantly affects the dopamine-producing neurons or brain cells in a specific area of the brain called the substantia nigra. Now, dopamine is a brain chemical that's required to initiate movement and to coordinate normal automatic movements like walking, for instance. So as dopamine levels drop off, you start to get these clinical signs. You start to get a tremor while at rest, and other forms of tremor can happen as well. And then slowness of movements, and sometimes trouble initiating movement. And then rigidity of the limbs, and sort of walking and balance problems. And then later on, you can actually develop dementia and memory loss in the later stages. So doctors don't like to administer dopamine drugs early in the early stage of the disease because the dopamine drugs can help to raise brain dopamine levels, but the effect of the drug starts to wear off after a while, and then the disease progresses. So they like to wait until the disease is already quite a ways down the road before they introduce medications. Now, the truth is that nutrition and lifestyle factors have been shown to play a really important role in slowing and stabilizing disease progression in many cases of Parkinson's disease. Now, lifestyle and nutritional medicine can actually address some of the underlying abnormalities that are responsible for Parkinson's disease, which include these two really important things: mitochondrial dysfunction, I'll explain it in a moment, and also free radical damage to nerve cells. So here's what happens. In Parkinson's disease, in the part of the brain that's affected by Parkinson's disease, the substantia nigra, inside those brain cells, the energy factories called the mitochondria become defective. And so they're unable to synthesize the optimal amount of energy that's required. And when there's less energy, those nerve cells can't make the dopamine that they used to make, so dopamine levels fall. And then on top of that, with that mitochondrial dysfunction, electrons are leaking out of the mitochondria, and they're interacting with oxygen in other parts of the cell, forming free radicals that then damage the nerve cell further and can cause nerve cell death and brain cell death. So just like if I take an apple and I cut it in half and I expose it to the oxygen and air, of course it starts to turn brown and rot after a few minutes. But if I cut the apple in half and I squeeze lemon juice on it, which has some antioxidants, it can slow down the rate at which the apple is rotting. And the same thing in our brains. If we can quench those free radicals before they do a lot of damage, then we can slow down the progression of nerve damage. And other nutrients have been shown to quench free radicals, slow the progression of the disease, and certain nutrients have been shown to actually help optimize energy production in the in the mitochondria, so that brain cell can make more energy and possibly produce more dopamine. And those nutrients have been shown in preliminary studies to help slow the progression of the disease, and I think it's worth noting their effects. And these are things that drugs cannot do. Now, other nutrients are also able to actually increase brain dopamine levels, and some nutrients can actually help to increase the memory chemical acetylcholine to help possibly stave off dementia and memory loss, which are also key factors in the later stages of Parkinson's disease. And of course, exercise plays a critical role in slowing and stabilizing the disease. There's tremendous evidence to show that. So the exact details of how to use nutrition, nutritional medicine, and targeted exercise strategies to improve outcomes in Parkinson's disease is outlined in this section of your feedback report. And it also includes the scientific references should you want to do some further reading on any one of those strategies. So I hope you find it helpful, and thank you for watching.